All right, well, here we are with another episode of our podcast, and today we have an amazing guest. Ladies and gentlemen, Abdelmalik.
Thank you.
How are you doing?
I'm happy to be with you today.
Same here. It's rare that we meet specialists who put a lot of time into one specific area of health. And before I go in, now that I've created that mini introduction, I would actually like to ask Andrew, who is Andrew? Who are you? What do you do? Who is Andrew?
Yeah. So first of all, thanks for this opportunity to be with you today. I'm a patient myself of scoliosis. If you know, so for people to know more about scoliosis, so when you notice some hump in the back and the shoulders are higher on the other side, so the spine is shifted to one of the two sides. So I'm a patient myself. I was diagnosed during college days because normally you don't have awareness in our country. So I'm from Egypt, and I found it hard to treat or to know information. So I really suffered for a few months till I was searching on the internet, and I found something called SCHROTH method.
SCHROTH method?
Yeah.
Okay. You're in college?
Yes.
What were you studying?
Physiotherapy.
Okay, so you are a physiotherapist?
Exactly.
Okay. So you're in college, you're diagnosed. How did you reach a diagnosis and you said you were suffering? What was the experience about?
So first of all, I was noticing that I have something different from my friends, and even my shape, I found that there are differences in both sides of my trunk or my body, or upper body. So, and there is lack of strength, loss of balance, so no pain at all. That's why it's hard to diagnose at the beginning. And even I didn't have much symptoms that could my family diagnose it or know that something wrong. So I was trying a new clothes or something. So my dad noticed, what is in your back? So he found one side is higher than the other side. And since then we are searching. So I went to the clinic, outpatient clinic in my university, and they asked me for X-ray. So, and we found my spine is shifted to one side than the other.
But there was no warning signs before that when you were a teenager? No, nothing whatsoever. It just appeared while you were in college. You were mentioning, you said something that's really important and resonated with me, is that you identified that there is an issue. You were searching for answers, but that you were suffering, but you didn't have pain.
Yeah.
I think that obviously points to the question, what exactly did you mean?
So scoliosis patients, including me, they feel like they are not normal. So their body is not symmetric. So they feel this asymmetry in their clothes when they wear it. And their trunk, to some extent, it's shorter than normal. And they have something on one side is higher, or the ribs on one side is higher than the other side. So this is not normal. So they suffer psychologically, and at the same time, this loss of balance, I couldn't know why I don't have good balance like my friends. They don't practice anything like me, but there is something different. I lack power, and some movements I couldn't do like them. I have long upper limb, but compared to my trunk. So for me, I didn't have answers. I was just asking myself every day, what's happening? But no answer. I'm normal, but maybe I'm weak.
Assumptions, because
Exactly.
at the end of the day, you didn't have enough information at the time.
Exactly.
When you said balance, what felt off? What were those movements that you said, hey, you know what, this is a bit strange?
Yeah, I was maybe when I'm walking in the street or trying to run, so anybody just touches me, I'm out. And sometimes when I'm playing with them, when we are in the school, so I find it difficult to control my balance when I'm on one leg, standing on one leg. That's why.
Oh, wow. Okay. So it was disruptive to your daily experience. This was not something that you identified once and you go like, oh, it's a bit off. It kind of hits you.
Yeah, to some extent.
Okay. So you continued physiotherapy.
Yeah.
What, you looking for answers. You search the internet. What happens next?
So one part of this suffering is that they asked me to change my college because they told me you won't be able to continue. You will have a big surgery later on. So you have to go to maybe business department or whatever, but you have to turn away from physio.
No, hold on. You're telling me that you got diagnosed with after the X-ray, and your university told you have to go?
Yeah, the dean told me, how did you get inside? So
How did you get in?
yes, and I'm afraid that maybe you couldn't continue. But it was my decision, so I kept lost for the next few months. I was searching and trying to know more information because when I went to some doctors, so I went to maybe 6 or 7 doctors, and they couldn't give me a systematic approach or how to deal with this situation, what are the numbers. So they don't have clear answers, even foreign doctors, not from Egypt.
I see.
Yeah, so since then I was searching, and this took me a lot of time. And even what I mentioned before about SCHROTH method, I took the old book of Leonard SCHROTH,
Right.
so and start reading maybe more than 30 times for the next 5 years.
So, because I think it's important to have clarity. If I understand correctly, once your school and your dean has understood your circumstance, he was concerned that you will be standing for long periods of time in surgeries, and that would provide discomfort given the asymmetry. And he made a recommendation that maybe you would want to continue in another department, and you chose to remain and to stick to physiotherapy.
Exactly, and even I tried bracing for 1 month.
You actually wore a brace.
Yeah.
Can you describe what's a brace really? Because people, when they think of a brace, they think of something around here, right? Something around the midsection or around the joint. But scoliosis is a bit different. So
yeah. So bracing and scoliosis was a little bit vague in the past maybe 20 or 25 years. So the most famous brand name was Boston braces, and they were like a tube, and this tube is covering from under the shoulder till the pelvis.
Till the pelvis, right?
And there are pressure points inside that are trying to push the spine from both sides to realign it in the middle.
Kind of forcing it.
Exactly.
That doesn't sound like a pleasant experience.
Yeah, so in this bad model they try to do so, but bracing is you could consider it as a guidance of growth. So it just puts some pressure and the spine is growing up and it's realigned automatically.
Oh, I see. So it kind of guides the process
Exactly.
as the person grows up into adulthood.
Yes.
So you tried that for a month and you remained in physiotherapy. 5 years you've been looking and you've been studying. By then you probably graduated from physiotherapy, right?
Exactly.
And what happens next?
So I was searching on SCHROTH method website and I couldn't find any certified therapist just to try the new one, and I couldn't be abroad in these years. So I found Dr. Wael Hassan. He started this career in Egypt, and I was a patient myself to him, and I went from I think 7 hours traveling to meet him 2 times. He gave me some insights, some exercises, and he was following up with me. Then after around 3 years, he contacted me while I'm graduating, and he asked me to start with courses. So he told me I have some connections because I want to improve what physiotherapy do with scoliosis. And since then we started with major scoliosis conservative treatment schools.
Okay. So now you started the treatment. Were you getting better? Were you improving after those recommendations by Dr. Wael?
You mean about my treatment?
Yes.
Yeah, for sure. And I found my shape is better, and we could measure it in many ways. So we take photos, we measure height, measure weight, everything, and we keep realigning the body in a better posture just to prevent it from going back to the scoliotic posture.
Okay, I want to be mindful of everybody watching, and I think it's important to define a few terms, if you don't mind. So, can you describe, before we move any further, scoliosis itself? What is it? When does it appear? And maybe who is prone to get this condition or develop this condition? You don't get it, you develop it. Would you mind sharing those insights?
Yes. So in X-rays, when we take X-rays for spine patients, we could find this shifting in the spine, but actually it's three-dimensional.
But you're talking a full spine X-ray, right? We're not talking like just a little.
Full spine.
It's from pelvis, including the head. Am I correct?
Yeah, full spine. So we find it in a three-dimensional deformity. So the spine is going like spiral shape inside, and we can detect it with CT scan. So when we do 3D reconstruction of the spine, we could see it very well how it's behaving. So
you mean computerized reconstruction of the spine, right? Like an image that you can actually
you can
twist
turn
and turn it, and you can see it's
360. Yes, exactly.
Okay, on the computer, right? Yes. So it's a visual aid to get to see the spine.
Exactly. Okay. So we found it this way. So the ways of treatment of scoliosis was very different nowadays. So nowadays we have conservative treatment, surgical treatment, and even surgery have many ways. Conservative treatment is the same. So this three-dimensional spine deformity is only a symptom of something happening inside. So it's a multifactorial disease.
What does that mean exactly?
So a lot of factors get inside and contribute scoliosis. So
what would be some of those factors, if you don't mind?
So maybe environmental factors, maybe genetic factors.
Right.
Maybe connective tissue is different. So the tissue who's connecting the bones and muscles inside is different.
Different from
normal people.
From the average majority.
Yes, exactly.
Okay.
And it's not yet, we couldn't find all factors, but what we know about it, that's 80% we don't know what is the cause. So 80% of the cases is idiopathic. So idiopathic means we don't know the exact reason.
When does it appear? Who is okay? How many people can have this? What are the statistics?
The statistics is more or less 3% of any population.
Okay, but that's over the course of their entire lifespan, or for specific age? And is that both for men and women, or boys and girls?
Yeah. More in female, so idiopathic scoliosis happens more in female, 2 to 1 compared to males.
So for every 2 women, there'll be 1 man that has.
Exactly.
Oh, okay.
Yeah, and it can happen in any time, but the majority of cases are adolescents, so between 10 and 15 years old.
All right. So I know there are going to be a few people around looking at their kids and be like, okay, we need to have a look. I haven't heard of any screening for kids. You know, my son is 10, he's turning 11. There is no such thing around the school, nor a yearly checkup with a doctor to check on that. So how would the parents be aware of this, and what should they do?
So parents should always see their son or children bodies, so they have to check them. If they suspect shoulder tilt, so one shoulder is higher than the other, or the neck is tilted to one direction to the other, or if we have a pelvis.
So I'm gonna be the kid, right?
Maybe so. You have a right shoulder maybe higher.
So like the right shoulder is like a bit higher, like that.
And your neck is tilted.
And then my neck is tilted towards the shoulder.
Yeah, maybe.
Or the shoulder's down, but my. So in other words, there's some sort of asymmetry going on.
Exactly.
Is that what? Then it's very obvious.
Exactly. And the pelvis is the same. So the pelvis also is it's tilted according to, because we have many variations of scoliosis.
Yes.
And you could suspect this hump, so you find the ribs near shoulder blade, you find one shoulder blade is higher than the other, and it's very apparent in an easy test you can do that you ask your son to go for forward bending.
To bend like, okay, so they're standing and they're just gonna bend as far as they can. Like
Exactly.
they're getting the spine to flex as if they're bringing their chin to their belly button.
Exactly.
Is that a accurate
Exactly.
description? Okay,
Just-
so they're
just
standing, they're doing that. What are we looking for?
So you are looking for, you could bring a butterfly, small butterfly. You can work it like the balance between two sides, and you get it on the spine while he's bending
Like you
forward.
roll it.
Exactly, and on the spine. So the spine, so the children's or the children is going forward bending, and you have to check: is there any tilt? Is there any is it any part higher than the other? Since then, you have to go to the doctor, and he checks it.
Okay, so I know that quite a few of you are going to wonder, like, what are they talking about, the bottle on the back? So what we're going to do is, soon enough, our team will post a video specifically about the Adams test and what you can do at home just to check. We don't want to panic anybody, but there are consequences to not identifying scoliosis early on. Am I correct? What would be those consequences?
So consequences, right now we found that some patients progress later on in their life. So they have scoliosis and they live happily. So normally scoliosis doesn't cause disability. So just not to be afraid of it.
Excellent.
And when they go to, they become elderly, they could have some degeneration. So the spine gets out more and they could have leg pain, numbness, and etc.
So if you're degeneration, you're referring to that bone tissue changing over time due to pressure.
Exactly.
And because we don't metabolize nutrients as easily, we end up with deformities. And eventually the spaces between the vertebra become smaller and smaller. And as a result, because there's also a curve, we end up impinging the nervous tissue that leads nervous signals to the legs and other parts of the body, and that creates pain.
Exactly.
Is that common with scoliosis patients who are, let's say, 60 and up, 60 years old or above?
Yeah, it could happen.
It could happen.
Yeah, you cannot guarantee this, but sometimes it happens, especially after 50 years old and in female after menopause.
Yeah, that's a big issue. We have with our team quite a few clients with menopause. We've managed to help quite a lot of people and increase their bone density, but we see spine fractures, and we've seen so many. So for context, our team has actually done the SCHROTH course, the level 1, with Andrew. Andrew is actually a tutor now. I know that he's taking a while with the story, but I gotta tell you, this guy is absolutely amazing. So we spent 5 days learning about the spine and understanding what scoliosis and other deformities are about, and that was an amazing experience. That's why it's so valuable that you guys listen to this, because I know 3% sounds like little, but we were surprised in our practice that we found at least 10 people that we screened before for asymmetries, but we would say, okay, he has an elevated shoulder. Oh, okay, it's an elevated shoulder. Oh, the hips, there's a hip hike or what have you, which basically means the hip is higher on one side. But the reality is when we applied the Adams test and a few other metrics, we found at least 10 people with a variation of scoliosis.
Yes.
And so it's not that, it seems like it's uncommon, and it's actually less common than we think. And it appears at different ages as well. So I'm wondering how many actually maybe don't even get reported, to be frank with you. It's extremely important that we understand this more. So now that we're going to do this Adams test, I don't want to take more time, but coming back to the topic of SCHROTH and scoliosis, you mentioned there's no in dysfunction later on, with some exceptions, of course. So what should people do? Let's say that they've identified there is such an issue. What would be the course of action? What is the next step?
So first of all, you have to go to the hospital or orthopedics doctor and they diagnose them. If they already it's done and they have scoliosis, so scoliosis in a simple way, we get an x-ray, and when we get this x-ray, we find more than 10 degrees. So we find this side shifting and side bending of the spine, and the doctor is measuring it and he found it more than 10 degrees.
So that's like the spine is curved away from the center,
Exactly.
and that circle represents an angle of 10 degrees or more.
Exactly. And since then, we have to know. So low to moderate curves, we go for SCHROTH exercises. If we have moderate to or less than severe, so maybe less than 40 degrees, we go for bracing plus exercises. And above 45, 50 degrees, if the surgeon or the doctor is prescribing surgery, so maybe we need it.
I see. So there are levels of indication.
Exactly.
The assessment though and the screening needs to be very, very thorough and accurate because people could end up with different readings depending on who they see. So in that case, if they do get, let's say, a severe assessment, a severe result, right, or categorization, do you recommend for them to seek a second opinion and redo the tests and the measurements, or is the likelihood of getting anything different quite low?
I will give you my approach for this. So I'm always realistic with my patients. So when they come to me, so in Egypt, they can access me before the doctor. It's allowed.
Right.
So when they come to me, I'm giving them the right expectation. So I give them minimum, maximum expectations, and they choose. So I tell them, okay, this is I couldn't do, or I can do 1, 2, 3, and I couldn't change your curb angle, and it may become more severe in the future. So I give them the choice, and they can go to the surgeon. So I'm always working with surgeons, and they find it more safer that we communicate with each other, and at the end, this is their choice.
Right. So your scope of practice, what you do within your clinic, and by the way, he has a clinic. His favorite number is number 7. So he called his place Scolio 7. It sounds pretty cool. So what's happening is you go through the process of helping them, assessing, starting with the SCHROTH exercises, which imply a lot of breathing and controlled positioning and bracing. And the people learn and they evolve. Some of them improve. Some cases are a bit more challenging, given that it is idiopathic. We don't know what created it, so it's difficult to predict this is going to work 100%. And as you go through that process, people want to go back to their daily life. They want to, not that they left their daily life, but they want to enjoy their daily life. What is the number one thing that scoliosis patients are looking for?
Number one,
people with scoliosis.
Yeah. So in adolescents, they seek better shape or more better cosmetic appearance.
Aesthetics.
Yeah. And actually, the majority of them doesn't have pain. But for adults, they seek to relieve pain because it can cause mechanical pain. Mechanical pain means the body is not so well aligned and it's out of balance. So they try to compensate, and it generates pain inside the muscle because it's doing too much effort to just keep it upright.
Right. So coming back to the big question, scoliosis is not something that people simply resolve, is it? They have to manage over time and even prevent the curves aggravating over time. How do they go about doing that?
First of all, I think school screening is very important especially if we have family history. So scoliosis run in families.
Right.
And better to know it from the beginning, to deal with it from the beginning, than to go with more severe curves. Then we have to have a brace with exercises or surgery. The experience itself is not so easy on the family and on the children, because you could imagine an adolescent that goes to a clinic for 2 to 3 times per week and does a lot of effort, have to do exercise at home and to wear a brace, and the brace have some not so good psychological effect because he feels like he's different than his colleagues. So they need a lot of support, and even the families, they don't know what is the right decision. So guidelines, we have guidelines in surgery or conservative treatment, but we still don't know exactly what will happen in the future.
Fair enough. It sounds like number one is screening. Let's find out if there's an issue early on. The earlier we know, the faster we can deal with it.
Yeah.
And then is learn about it. That's what we try to do here today, is share with people information that is really relevant to this situation. Andrew, I think this has been an amazing first conversation. I think a lot of value is going to come out. And by the way, if you have any scoliosis questions or scoliosis related questions, pop them in the comments below. And if you want to reach Andrew, where can people reach you?
I have Instagram page for my clinic. They could reach us and we will help them. So
that's Scolio7 on
Scolio7
Instagram.
clinic, yeah, Scolio7 Andrew Muhib, and we could help them a lot. And yeah, whenever they have any question, I would be happy to help them.
That's amazing. Yeah. That's amazing. I've seen, we've met with Andrew last year and we've had great conversations so far, a lot of insights, a lot of back and forth, and he's been very generous with his time and the knowledge that he acquired. So don't hesitate, guys. Get in touch if you have any questions related to scoliosis. We feel this is a field that's expanding. And Andrew, thank you for all that you do, man.
Thanks, Marian, for having me.
It's my pleasure. Looking forward to the next one.
Yeah.